Have you ever said to yourself, man, I tried the physical therapy thing and it didn't work for me? Well, perhaps you didn't find the right PT for you. And that's exactly what we're going to identify in this video, how to find a great PT. How's it going, guys? Dr. Chris Sovey back with another episode of Working Body Wednesdays. Working Body Wednesdays is where we talk about posture, functional movement, and hardening your body so it's better able to handle the demands of daily life. If that sounds like something that's interesting to you, be sure to subscribe and hit the little bell so you never miss another video again. Now, obviously, it's a little bit of a shameless plug here for me in terms of being a physical therapist. I think that it's critical to be engaged in your patients. But what I find when a lot of people come to our clinic is that they've tried physical therapy many times and they've got either no relief or mediocre relief. And here's the kicker, here's the insider kicker here, guys, the little secret is that there's an incredible amount of variation in the training of physical therapists and different philosophies in how physical therapy is approached and implemented. So sure, when we go to school, we have a certain curriculum, a bare curriculum that we need to pass our boards. But then after that point, people tend to branch out into different types of models or different types of training, and then they find what seems to work best for them. And often, several of these therapists are very well trained and incredibly knowledgeable, but what happens is the system brings them down. Perhaps you've had an experience, maybe this sounds familiar to you, where you went to a physical therapy clinic, they put you on a bike, they gave you 3 or 4 exercises to do, and then they ran off into another room and attended to 3 or 4 different clients. That's commonplace. And the reason that people are doing this is, the reason businesses are doing this is because the reimbursement rates are constantly going down and down. So the volume has to go up and up in order for these places to stay in business. It's not that they don't care about you. It's simply that they have to fulfill this volume in order to stay in business. They'd love to spend more time with you if they could. So one of the first things to do when you're trying to find a great physical therapist is ask some questions when you're looking into clients. So maybe you got your script for physical therapy if it requires one in your state, because each state is different, by the way, too. Direct access varies from state to state. But if you're looking for a great physical therapist, call the clinic and ask some questions. One of the first questions should be, does the physical therapist spend one-on-one time with you, hands-on one-on-one time with you every visit? And I think that's critical. If therapy is hands-off and somebody gives you a cookie-cutter program, they're like, well, you got hip pain, so we're going to do 2 sets of 10 of clamshells, or this exercise, or bridges, or something like that. And there's no hands-on manipulation of the body, which, by the way, isn't always required, but usually is included as part of the plan of care. That's a red flag. So I would call, and when you're looking into different clinics, I would ask, do you provide one-on-one care with a physical therapist every visit? Now, that doesn't mean you might be with the physical therapist the entire visit, but that's certainly a bonus. And that's how I always try and operate with my care with clients, is to be one-on-one the entire visit, because I found that we get much better results. Another critical component to finding a great PT is, this is true with any business, is to ask around. Ask other people that have had physical therapy and have got great results with a condition that's similar to yours. And then ask them a little bit about their experience. What was it like? What were some of the things that they do? Again, did they put their hands on you? Or did they simply put you in a corner and slap some electrical stimulation on you in a hot pack and call it good, and then tell you to just do these exercises and that's all? If that's the case, that might be a little bit of a red flag. But if you've seen several others that have had a great experience with a similar condition to yours, that might be a great place to start. Now, in our current times, the internet is making things more and more transparent than ever before. So you have a lot of options there to read reviews, and take those with a grain of salt, because I'll tell you, there are certainly times where People are only going to review the bad things. They don't take the time to review the good things. But if you see some great results from people on there, that's another good sign. So you're starting to kind of make a little checklist here of the things that look like a good sign for a great physical therapist. And then let's say you decided on a clinic and you go in for an evaluation. This is time to start to assess the relationship a little bit. First impressions can mean a lot. And if it doesn't, just like any other provider, like a mental health provider or a physician, if it doesn't seem to click, go ahead and get a second opinion if you feel it's necessary. Ask them questions about their plan of care. What is the long-term goal? What are we going to accomplish? Are we going to look at this as a whole picture, not just you're a shoulder patient? Did they assess you in your whole body and see if there are any other contributors? And that's why I also have to say, some of the best providers that I've found do not accept or do not participate in insurance because they have more time to do this. I've spent a great deal of money myself going out of my way and paying out of pocket. So sometimes you might need to find people like that as well. What have your experiences been with physical therapy? Have you had good experiences, bad experiences? What made the difference for you? Why did you classify it as a bad or a good experience or a mediocre experience? I'd love to hear, because not only just to hear about your experience, but being a physical therapist, I always want to advance our profession as well. And so if there are things that we can do as PTs to help you recover at a more thorough and faster rate, of course we want to hear about those. So this has been another episode of Working Body Wednesdays. If you enjoyed this video, be sure to subscribe. Ask any questions you want down below. I'm usually very good at responding to comments, and I will post just about every Wednesday, so check back every Wednesday evening. I post about 5 p.m. Eastern time, and I look forward to seeing you guys next Wednesday.